Ectropion. Introduction. Ectropion is a condition in which the eyelid, usually the lower eyelid, turns outward, exposing the inner conjunctival surface. This malposition leads to excessive tearing, irritation, dryness, and an increased risk of eye infections. It can be congenital, age-related, or caused by trauma, facial nerve palsy, or previous surgeries. Proper diagnosis and timely management are essential to prevent complications such as corneal damage. Definition. According to the American Academy of Ophthalmology, ectropion is an outward turning of the eyelid margin, resulting in exposure of the inner conjunctiva and improper drainage of tears. According to the World Health Organization, WHO, a condition where the eyelid is abnormally positioned, leading to irritation, excessive tearing, and potential corneal damage. Risk factors. 1. Age-related factors. Weakening of eyelid muscles and connective tissues due to aging. Loss of skin elasticity over time. 2. Neurological and muscular disorders. Facial nerve palsy, example Bell's palsy. Stroke or neurological diseases affecting eyelid control. 3. Trauma and surgical causes. Eyelid injuries leading to scarring. Complications from previous eyelid surgeries, example blepharoplasty. 4. Congenital and genetic causes. Present at birth due to structural abnormalities. Genetic disorders affecting facial muscle tone. 5. Inflammatory and infectious causes. Chronic conjunctivitis or blepharitis. Skin conditions like eczema or dermatitis affecting the eyelids. Etiology. Ectropion can be classified based on its causes. 1. Involutional, age-related, ectropion. Most common type. Due to age-related weakening of the eyelid muscles and connective tissues. 2. Paralytic ectropion. Caused by facial nerve palsy, example Bell's palsy, stroke. Leads to loss of muscle tone, causing the eyelid to droop outward. 3. Cicatricial, scarring, ectropion. Results from trauma, burns, or surgical scars. Causes tightening and pulling of the eyelid skin, leading to eversion. 4. Mechanical ectropion. Due to tumors or excessive weight on the eyelid. 5. Congenital ectropion. Present from birth, often associated with genetic syndromes like Down syndrome. Pathophysiology. Weakening of lower eyelid tissues, due to aging, paralysis, scarring, or congenital factors. Down arrow. Loss of eyelid support, decreased muscle tone and connective tissue elasticity. Down arrow. Eversion of the eyelid, outward turning of the eyelid margin. Down arrow. Exposure of the conjunctiva, inner eyelid surface remains exposed. Down arrow. Inadequate tear drainage, tears overflow due to improper positioning of the tear ducts. Down arrow. Ocular irritation and dryness, increased risk of infections, corneal damage, and discomfort. Clinical manifestations. Outward turning of the eyelid, most commonly the lower eyelid. Excessive tearing, epiphora, due to improper drainage. Dryness and irritation from exposure of the conjunctiva. Redness and inflammation of the eye. Burning or gritty sensation in the eye. Sensitivity to light, photophobia. Blurry vision due to corneal irritation. Recurrent eye infections such as conjunctivitis. Diagnostic evaluation. 1. History taking. Assess for symptoms such as excessive tearing, irritation, or vision changes. Review medical history for facial nerve palsy, trauma, surgeries, or chronic eye conditions. 2. Physical examination. Slit lamp examination evaluates eyelid position, corneal health, and tear film stability. Snapback test assesses eyelid laxity by pulling it away from the eye and observing how quickly it returns. Tear drainage assessment checks if tears are properly drained through the nasolacrimal duct. 3. Imaging tests. MRI or CT scan if facial nerve damage or tumors are suspected. Fluorescein staining, to check for corneal abrasions. Medical management. 1. Pharmacological treatment. Lubricating eye drops and ointments to keep the eyes moist. Topical antibiotics, example erythromycin, ciprofloxacin, for secondary infections. Steroid eye drops to reduce inflammation. 2. Non-pharmacological treatment. Eyelid taping to hold the eyelid in a normal position temporarily. Moisture goggles to protect the eyes from excessive dryness. Surgical management. Surgical intervention is required for severe cases. Eyelid tightening, lateral tarsal strip procedure shortens and repositions the eyelid. Skin grafts, used in cases of cicatricial ectropion to add extra skin. Mid-face lift, lifts sagging skin to provide eyelid support. Canthoplasty, reconstruction of the outer eyelid corner for stability. Nursing management. 1. Impaired ocular protection related to eyelid malposition leading to inadequate eye coverage. Interventions. Administer prescribed lubricating eye drops or artificial tears to prevent dryness. Apply ophthalmic ointments at night to maintain eye moisture. Educate the patient about proper eye hygiene and avoiding eye rubbing. Encourage the use of protective eyewear to shield the eye from dust and debris. Monitor for signs of corneal damage, such as redness, pain, or blurred vision. 2. Risk for corneal ulceration related to chronic exposure of the ocular surface. Interventions. Regularly assess the eye for signs of irritation, infection, or ulceration. Encourage frequent blinking to help distribute tears evenly. Use a humidifier in dry environments to reduce tear evaporation. Position the patient's head slightly elevated during sleep to prevent excessive tear drainage. Collaborate with ophthalmologists for potential surgical correction if conservative measures fail. 3. Excessive tearing, epiphora, related to improper tear drainage due to lower eyelid eversion. Interventions. Clean the eye gently with sterile gauze to remove excess tears and prevent skin irritation. Apply prescribed topical antibiotics if infection is suspected. Teach the patient to use warm compresses to improve tear drainage. Assist with eyelid taping, if recommended, to temporarily improve lid positioning. Educate the patient on surgical options such as lid tightening procedures for severe cases. 4. Risk for impaired skin integrity related to chronic exposure of the lower eyelid and excessive tearing. Interventions. Apply a protective barrier ointment or petroleum jelly to the lower eyelid to prevent skin breakdown. Keep the periocular area clean and dry to prevent maceration. Reposition the eyelid manually if needed and instruct the patient on proper handling. Encourage the patient to avoid harsh soaps or irritants near the eyes. Monitor for signs of infection, such as redness, swelling, or discharge. Prevention. Regular eye examinations, early detection can prevent complications. Proper eye hygiene, cleaning the eyelids to prevent infections. Management of underlying conditions, controlling neurological disorders, skin conditions, or facial nerve paralysis. Use of protective eyewear, prevents trauma that could lead to cicatricial ectropion. Avoid rubbing the eyes, reduces mechanical damage to the eyelid. Complications. Chronic eye infections, due to inadequate tear drainage. Corneal ulceration, can lead to vision loss if untreated. Persistent eye irritation and pain, decreased quality of life. Scarring and deformity, if not managed properly, leading to permanent structural changes. Conclusion. Ectropion is a potentially serious eyelid disorder that requires early diagnosis and appropriate management to prevent complications. While mild cases can be managed with lubricants and conservative treatments, severe cases often require surgical correction. Proper eye care, regular follow-ups, and patient education play a crucial role in improving outcomes for individuals with ectropion.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.